EK, we have Touch Healthcare as well, where we'll train 200 healthcare professionals to be certified in ACLS, PALS, and BLS. These are basic certification that healthcare professionals, especially doctors and the nurses who are at the higher levels, to be trained in. And we also have basic life support training as well for our healthcare workers, and we'll have healthcare workers coming over from Nevis. In addition to that, we will start the customer service training of our nurses as well and our healthcare professionals. Because one of the issues that people have been complaining of is customer service. And so that customer service training, after we would have certified them, because no doctor should be working at the hospital without being certified. And that has to be corrected quickly. If we had stopped, we are black men over 40 and our heart stopped, and we go there, we want to make sure that the doctor is there, nurses there, they're certified to resuscitate us. And those are basic things that we'll do. Right after that, on the heels of that, we'll start the customer service of all of our healthcare workers, especially at the hospital level. And so while we are making the infrastructural changes there, we want to make sure that we change the human capacity and take care of the human resource. So far, we have a director of health, institutions who a position that was vacant for a long time. Dr. Jensen Morton has been appointed to that position. We also had an issue where we needed more help in operations at the hospital, and Ms. Lindsay Francis, who has a master's degree in operations, she is now at the hospital. We are also getting ready to put in place a PNO, a principal nursing officer. So we are upgrading our professionals and our personnel in the healthcare field, and we are also investing in their treatment, in the training as well. Of course, you know that we already procured the MRI machine, which is being built at this time to be installed in JNF. And good news, EK, I had the first concept of the new JNF hospital presented to me today. And that would be one of the major things that we will do. And so I am excited from our discussions and what we have seen, and the people of St. Kitts and Nevis would know that they will not only get a new hospital, but they would get a staff or professionals or healthcare workers who are trained in the medical field or healthcare related field. But not only that, but they will also be retrained in customer service so that we can take care of the many complaints sometimes. But I want to say that our healthcare workers, they work hard, and if we give them the tools, they can even improve on what they deliver already. I want to say, with respect to the dialysis unit I've contacted, I want to thank those in Canada who have been working with me to procure some machines so that we can have them available for us here in St. Kitts and Nevis. So all in all, I want to say that healthcare is on a good footing. It's moving forward. I want to also inform the public that Dr. Patrick Martin has been brought on as a special advisor in health. He will be looking at fundamentally three things. One, he'll be looking at our national health insurance, because we're going to move ahead also with national health insurance as was promised as part of our universal health care. He would also have purview over the construction of the new hospital. He'll be the point person on that. And he will also seek to establish linkages with us, St. Kitts and Nevis JNF Hospital, with other hospitals, so that if you were to go to JNF and your illness cannot be treated there, then you'll be an automatic transfer to an institution where we have a formal relationship. And so you don't have to be running around wondering where your loved one would go. And so we're going to also put at JNF as hospital telemedicine, where if you need to consult a specialist from overseas that you don't have here, you can do what you call telemedicine, which is a consultation via the virtual media.